Hi, I'm Tim Williams with Dwyer Williams Potter Attorneys. I'm a partner and the lead litigation attorney at the firm. I'd like to talk today about the spine. As you can see in the diagram, the human body is composed of bones over which muscles and the skin lie. Today we're going to focus on the back, and you'll see that in the middle of the diagram, just below the sternum. The spine is comprised of several areas. The cervical area is at the top, and that's commonly referred to as the neck. Next is a thoracic area, and that's the mid-back. Finally, there's a lumbar area, or the low back. And below that lies the sacrum, and then down at the bottom is the coccyx. As you can see, the back is comprised of several layers of bones. These are called the vertebrae, and they stack on top of each other. In between each vertebrae lies a disc, and these discs are softer and allow for movement of the back. Towards the back of the back, or the spine, exist these bony prominences, and these stick out and allow muscles to attach to them, which allows the back to move. You can see that there's the central spinal cord here in yellow. It extends down through this canal in the back and out from which extends these smaller nerves, and the nerves innervate the body and allow for movement and also for pain reception. And here we have two vertebrae so we can get a closer look. And those are the bony portions of the back, and between which is the disc. And this is pretty neat because we can take this off and get a closer look. So you take it off, and again, this is the vertebrae, or the bone, that comprises one level of the back. If you hold it up like this, you can see where the spinal canal exists, so the spinal cord goes through that hole there, and then the nerves exiting off the spinal cord come out each side. So there's a vertebrae. And between the vertebrae is the disc. And so the disc is comprised essentially of a harder, fibrous material on the outside and a really jelly-like material on the inside. And if you think of a jelly donut, you have a pretty good idea of what a disc is. And sometimes this outer layer can become damaged and the inner jelly can leak out, and that's called a herniation, and you see that here. And so that's actually a herniated disc. This is a damaged disc here. This is the spinal cord, and you can see it's exiting out the little hole I showed you in the bottom vertebrae. And these are the nerves exiting off the spinal cord there. And this is what goes, and for instance, it gives you nerve conduction to your arm or your other arm or perhaps your leg, depending on where in the body you're looking. So typically, injuries to the back involve the muscles that attach on the rear of the spine. They can involve the bony prominences of the spine itself, where the spine's broken, or even the vertebral body's broken. They can involve the discs, which are between, and you can have the herniations or bulges, as I discussed earlier. And they can also involve the nerves extending off and away from the back, or you can have an aggravation or a pinching of the nerve and cause significant pain. I want to thank you for watching this video. Please feel free to check out other videos on our website.